ready for me to talk. Did you want? So thank you, Carl. I'm going to go into our video space. Today we're going to talk about masks. And we've had several questions on how to donate. Here's a few of them. I'll go back if we have other questions on that. The overall weekend was fantastic. I took a couple of days off. Todd got the hopefully final draft of the manuscript on plaque and what a stress test won't tell you. That's probably going to be the title. Here's the problem, though. Very early into the book, I sort of got way too deep in terms of inflammation, cardiovascular inflammation. And as Todd and I both read it, we both felt like, you know what, that's too deep a hole, too far of a digression, and it's going to deter readers. So I spent about 6 hours on trying to clean that up, and you would think I would know how to do that, but total nightmare. Anyway, it's a good problem to have. Back to today's video. The U.S. gets into masks. Janice made some for our family, and we'll talk about those. And Janice is here to talk about them. But before we do a brief intro from my side, obviously the pandemic continues to mature. We're back on a major uphill battle, or an uphill component of the curve. That's being driven to a large part by the U.S. The U.S. was, what, 13th to 15th down the list just, 3 weeks ago, and we went right to the top and remain at the top. We are more than twice, almost 3 times number 2, which is now Spain. And we, for many of our big areas like New York, Detroit, this is appears to be the peak week. A lot of people have said, you know what, we need to figure out how we're going to manage our schedule in this space. And I remember quoting Tony Fauci again recently with, we'll do whatever we want to in terms of our schedule, but the virus is going to determine the schedule. One of my viewers, speaking of Tony Fauci, one of my viewers sent me a video which got into the whole perception of Tony Fauci, Bill Gates, Harvard. What's the word I'm looking for? It really politicized things, presented it almost as a conspiracy. And it's like, you know, okay, let's. We got politics on both sides of the fence. Not going to go there. And you might not like this if you're not very tolerant of foul language. You probably don't want to see this video, but I think it makes a great point. You know, the pandemic may have matured in terms of what's going on, or continues to mature, but for many of us, our emotional reactions haven't matured. And Samuel Jackson's got a great video. It's gone viral. There's a lot of folks watching it on Facebook and some other ones. And it's stayed the blank home. It's written in a children's book format. Obviously, it's not a book that you would read to a child because of the language. But you know what? It's making the point that with our emotions about staying at home, many of us are acting like children. I thought it was a great video. Now, let's talk about masks for a few minutes. For decades, a lot of the Eastern cultures, Japan, China, and several other cultures were much more willing, much more likely to use masks in public. We didn't so
Doc,
much in the U.S.
I'm
Yes.
sorry. Can you share your screen? I think you have
Oh,
shared.
darn it. Thank you, Carl. You know what? Let's go. It's so frustrating. Yet more. Ah, let me find it. No, that's not it. Mm, 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 mm. So let's go run back through the major uptick for, especially for the U.S. Samuel Jackson has shared, for those of us whose emotional components of staying at home, a children's book, since we're acting like children sometimes. And you know what? We have to. I have to. I get frustrated. Let's talk about masks. The CDC has said, look, you know what? Maybe we ought to reconsider what we've done over the past two to 4 decades or more, where some of the Eastern cultures were saying, yep, we'll wear masks out in public. In the Western cultures, we didn't do that. This is not so much, the way I understand it, it's not so much to protect ourselves from the virus in the air, but to help decrease the viral load in the air from those of us who have the disease and don't know it and are breathing it, exhaling it, coughing it, sneezing it. And as many have seen from some of the recent research, yep, just talking and just breathing can distribute that virus. So I had some other components on a recent study from Lancet, which showed that the virus can actually be detected in the bloodstream, and maybe even therefore you might be infectious for up to 37 days. That's obviously going to have some more import and impact in terms of how we manage this virus over the next couple of years. So masks, now that we're talking about using masks here in Western cultures, overnight, they've become a lifestyle issue. We talked about lifestyles and how they determine health. For example, cardiovascular lifestyle, diet, diet, diet. That's a big issue. Also exercise, sleep, things like that. For other things, for kidney disease, for eye disease, for cognitive decline, lifestyle's major issue. For things that we might not have thought about, a lot of folks on this channel, ADHD, lifestyle issues, HIV-related issues, lifestyle. Again, some differences there in terms of one of the key components for lifestyle for HIV-related diseases is safe sex. So lifestyle is the major determinant of our health, no matter which component we're talking about. It may change a little bit, but some of the key things that you're gonna see over and over again have to do with diet, sleep, management of stress, exercise, social ability to interact with others. And again, we just had something else inserted into the lifestyle components for COVID-19, masks. So now that it's now a big lifestyle issue, overnight, masks went from what? $12 to $89 to $120. And Trump is saying the CDC is advising masks. He's not planning on using one. Again, politics is always going to be part of this issue. As you see, this is one of Janice's favorite masks, the Kente fabric. She can tell you a little bit about that when she comes in. And yes, some places where you might not have thought about it. Religion. What has religion got to do with the masks? Well, Israel's now going to start producing special masks to accommodate beards for folks who maintain beards for religious purposes. So Janice, if you're ready,
Yes.
I would like for you to go ahead and tell us a little bit about the masks you made. And when you want me to, I'll drop this this screen and put the other thing up, because again, another challenge, my sketch went out and I can't add things to slides as of about half an hour ago.
Okay, so on Friday, the CDC recommended that people wear homemade cloth face coverings or masks, not to go out and, not that you can purchase the N95, not to use the masks that healthcare workers need, the surgical N95s. But these are homemade face coverings. Why? Because they recommend wearing them in public settings where other social distancing measures are difficult, such as the grocery store and pharmacy, which people are still frequenting too often, especially where there's a lot of community-based transmission. And then the other reason is to slow the spread of the virus from the asymptomatic people who have the virus but don't know it because they don't have symptoms.
So in other words, the mask is, as I mentioned before, that homemade home cloth type of mask is not so much to protect you from virus in the air as it is to protect the air from virus that might be in you and you don't know it. Is that right? Is that what they said in there?
I think it's both. It protects you when you go out where you can't socially distance, and then it protects people from spreading that are asymptomatic. So when I heard the CDC recommendation, I knew a month ago, on March 3rd, when I did a grocery shopping trip, and I could buy gloves, but not masks, that they were already gone.
This was going to be an issue.
Yeah, this was going to be an issue. Actually, I saw a gentleman in mid-January in the Chicago airport, or Atlanta en route to Chicago, who was wearing an N95, which then nobody even knew, or very few people knew what an N95 was. I don't know his history. Maybe he was coming back from China. I don't know. He had the N95, but I looked it up and they were readily available on Amazon at that point. And as we all know, have quickly disappeared.
I'm going to go get a t-shirt while you're there so you can help explain how you made these.
So that gentleman was ahead of the curve. So on Friday, a friend of mine recommended going on Etsy, ETSY, where they sell a lot of products that are created by people from working at home, a lot of crafts. And it was interesting. The one I settled on is Camerica Creations, which you see the brightly colored Kente cloth, which is an African type of fabric. Why did I choose this? It was not just the color, which is interesting.
But that was important, right?
Well,
the color
no.
and the pattern?
No. What was important, this had 2 layers. They had an optional 3rd layer. They also had sizing, which I did not see with any other masks. And they also, which was available in other masks, had a form-fitting over the nose. And so I had looked at a couple others, and even in the time span that I clicked on one that was $19.99. When I further clicked on it, it immediately went up to $154. So they knew they were going to have a supply-demand issue on Etsy that night.
It was interesting to see that one day that, what was that, Saturday? Friday? The cost on these things went up by a factor of 10, and the ability to get them went out by a month.
Right. So I just checked on this one today. She has only increased to $15. So she is not responding to that supply demand. And I think She has a good heart about making them. Apparently, she went into production over the weekend because some size medium was not available when I bought on Friday, and now all the sizes are available, and she tells how to measure. So I'm waiting for that. It's a 3 to 5 day delivery, and that is going to be a much better mask than the one that I chose to make. The CDC does have ones that will be better form fitted that are with sewing. My sister made one. She said it took several hours and she broke 2 sewing machine needles doing it. So
you want me to put this on?
Well, let me describe it
Okay.
first. So I decided on the no sew CDC recommended one, which is where you take a t-shirt and you can see there's a square around the bottom of the t-shirt and you cut off 7 to 8 inches straight across. Now, again, I want to, I am saying this is temporary measure for me. I'm going to wear the form-fitting mask when it comes from Etsy. But so I cut off that 7 to 8 inches, and then okay, I'm really onto this next one. I don't know if
you're looking at the slide.
Here. Yeah, the slide.
Should be able to. How's
okay,
that?
so there's the 7 to 8 inches. Now, if you go here, you're cutting out a rectangle in the middle of the 7 to 8 inches.
Can I just?
Okay. So you're cutting out a rectangle in the 7 to 8 inches, which will end up being your straps on either side, which you then clip so you have them. And the mask, Ford can demonstrate. You want to demonstrate it?
Yeah.
I don't know.
First, I was trying to.
Oh, okay. Yeah. Here, let me help you hold it. So there is that cloth. Now I cut it further, I think about 12 inches in to make a smaller mask. And the material, even though it's cotton, seems to have some stretch to it, 100% cotton. You are using a cotton material.
So this at top or the other one?
Yeah, that's one. This is a single layer mask. Again, not the one that is recommended. There's sewing, the mask you can sew has 2 layers. But this is a simple, you can do it in a couple minute mask. You tie it around the neck and then you tie it on top of the head, just like the picture shows. Are you on the screen?
I don't know. Can you see me, Carl?
Yeah, Doc.
Okay, good.
So that is at least a solution anybody can do today who doesn't have a sewing machine, who has a t-shirt and a pair of scissors.
And I can tell you, just from feeling and looking at it, look at the Kente mask that you're talking about. See this mask, I don't know if you can see this, but it's got significant gaps right here. Yeah. And yes, it may be no sew, but again, huge gaps.
And you don't want to touch your face a lot, which
right.
When it's doing that, you're more prone to touch your face. The recommendation is that you don't touch the mask, you take it off and you wash it every time you use it.
It helps you understand the importance of that
form-fitting
mask. That wire that fits in most masks right across the nose, because then you're able to pinch that out. Carl, I don't know if you can see that gap. Can you? Right there.
Yeah, I can see the gap.
Okay, very good.
So that's one item.
Should I show my
go ahead.
balaclava mask?
Well, let me just give the general recommendations about this. Could you pull up that slide, Ford?
It's not a slide. This, hold on.
Or I can read it.
This image. Carl, can you see this image now? This.
Yep.
Okay.
So the cloth face coverings, as you saw, does have some difficulty, but it should fit snugly against the side of the face. It's secured with ties. There's one with ear loops. It should include multiple layers of fabric. This one that is no-sew is 1 layer, and allow for breathing without restriction and able to be laundered and machine dried without damage.
So, but that's a different one. That's got loops in it. You have to sew that one, right?
Well, the picture is, but it's for any of them.
Oh, those are just some of the
general
key
guidelines.
components. So I'm going to show a mask that I've been using. It's basically just a balaclava as opposed to a mask. I've had this for years. It's more for warmth during the winter, and it can fit over ears and nose. But again, with all of these, what you tend to see is a significant gap, especially around the eyes where the nose comes up, especially when you've got a big old beak nose like I do, like Roman nose kind of thing.
And I found it a little irritating around the eyes, even wearing glasses.
It is.
And that's why the one that I ordered, I think, will be much better.
So for example,
it's probably worth the sewing to get one that fits, but not everyone has a sewing machine.
The glasses sort of help push that gap down. But again, that's why it's so nice to have these masks that have that form-fitting, pinchable wire inside. So again, that's the CDC recommendation as of Friday. It's created a huge demand. I would go to their website. I don't know if you have a slide of that, Ford. The CDC website?
For these masks.
I may be able to find it. I don't have it up. And again, CDC masks website. I don't know.
Well, let me see. It's just, I guess, go to cdc.gov and look up
that one?
How to wear a cloth face covering. Yes, that one. And then it goes down and gives you the ways to create them, how to clean them. It's not recommended for children under age 2 or anyone with breathing issues. And something you have to be able to remove the mask yourself. So if you scan down, you get to the sew and no sew instructions. As
you know, Janice, several of our friends, a couple of folks in our Sunday school class, are anesthesiologists. And an anesthesiologist who's actually doing surgery on or intubating people with COVID. I mean, there is no group that's at greater exposure. And they're talking about wearing some of the masks and coverings, shields with some of the supplied positive pressure airways. One of the things they continue to say is with a properly fit mask, it is very, very difficult to breathe, especially when you're doing something athletic like having to lift somebody's neck and jaw and chest up in order to insert a ventilator tube. Anything else on this?
No.
So thank you so much for appearing and being the main event. And why don't we just take a couple of questions? If you have any questions for Janice, I'd ask you to go ahead and put those out now, because she's going to be taken off and I'm going to be handling some of the more medical type questions. Okay, Bill Clifford. Now let me just see how we want to do that. Okay, here we go. Great weekend, more tech challenges, ready to roll. Well, we thought so, but I wasn't sharing it in the beginning. Okay, Bill Clifford, happy Monday from Estero, Florida. Bart Robinson, good morning to you and Janice. Hello. Thomas Rooney, good morning. Doug Thompson. Doug, how you doing? Doug and I did some work over the next couple of days. Doug and I will be presenting. As you know, Doug's presented on this channel several times. I've been after Doug for quite a few months to get a teledentistry program set up. Well, obviously, he had a lot of other things on his plate, but guess what? Teledentistry became a major focus for it, and he's now got that, and we'll be planning to cover that. Doug, let us know whether Tuesday or Wednesday makes, which day makes the most sense for you. Barnes J0007, good morning from Tampa. Thank you for what you do. Appreciated beyond what words can be said. Thank you so much, and that's why we're doing it. We're trying trying to make a contribution. Largo, Florida, Paul Neal, thank you. Mr. Number One, Ford, we appreciate you keeping us informed on how to stay safe during this evolving crisis. Keep up the good work. Thanks, Paul Neal. Hi, Barnes. Thanks, Janice. Hello, Neil. Okay, I've seen several, this is Dave Murphy. I've seen several reports of questionable methods of reporting deaths in order to artificially inflate the numbers. Well, actually, they talked about that in that conspiracy video that I talked about a few minutes ago. I don't think anybody is, well, I'm assuming the best at all times, and that's sometimes naive. Some people may be trying to inflate numbers, but, and here's where one of the places came up. There was a couple of political folks that said, no, the CDC has put out guidance, CDC and WHO, in terms of coding. They've created a couple of codes for COVID-19 and coronavirus, and when people are dying, the CDC put out a comment, evidently, over the past few days that said, look, it's not crystal clear all the time that you have everything you need to make a clean diagnosis. If you think it's COVID, go ahead and put that down. Well, a lot of people are interpreting that to say, oh, the CDC is saying just play it fast and loose and call everything COVID. You know what? I think if that were the only problem we have with numbers on this pandemic, we'd be in a much better shape than we are now. But I mean, you and I both know, we've looked at public health numbers in terms of everything else, other major determinants of health. Do you think the numbers are reliable for China?
No.
How about Africa?
I think there's
the poor countries of Africa.
I think you could say there's underreporting and overreporting. The underreporting are probably elderly who have not received their tests back and have died.
Right.
And they're probably given a diagnosis of heart disease or, you know.
Absolutely. I mean, that's the point I keep making.
I don't know. It's like, you know, splinters.
A lot of people have these, and I don't mean to, maybe I shouldn't use the term naive, but it is somewhat naive to think that public health numbers are always going to be clean and clear. They never are. We always have to take public health numbers, just like economic numbers, and figure out what's wrong with this set of numbers and make the best picture that we can. And sure enough, it's not always economics and resources and logistics that's going to mess up numbers. Politics are going to mess up numbers too. We just have to wade in, buyer beware.
And just to bring up the fact again that people with diabetes, prediabetes, undiagnosed prediabetes, heart disease are still or amongst the majority of people with COVID-19. So what diagnoses are they being given if they weren't even tested?
Such a great point. And you go back and you look at death numbers. They really predominate with things like pneumonia. Well, pneumonia is the grim reaper. It is the final harvester of people that had cancers, they had heart disease, they had a heart attack, which again,
those surgical patients. And
again, with heart attack, with stroke, we know that the major driving force on most of those was what this channel is all about, just right. What you brought up, prediabetes. So number one cause of death, heart attack, really caused by prediabetes. We call it heart attack, but it's prediabetes that's driving it. Number one cause of disability. It's called strokes, right? Mm-hmm. But what's driving those strokes? Prediabetes. Mm-hmm. And mostly unrecognized prediabetes. Prediabetes that people don't know that they have. So, and guess what? Just as you brought up, I had a slide which superimposed the heart attack death rates, the stroke death rates, and now COVID death rates. Because just as you said, what's really underlying the COVID death rates?
Death rates.
Death rates.
Prediabetes.
Prediabetes again. So heart attack, stroke, now COVID are all the final arbiter, the grim reaper, the thing that's doing the final damage. But all of the original damage is coming from prediabetes, and we're just not even recognizing it. Tell me where the statistics are. Back before we were using continuous glucose monitoring, before we were using OGTTs, before we were using insulin surveys, the CDC said, well, a third of adults, 80 million, have prediabetes, and only 8 million know about it. Mm-hmm. Guess what? Once you start using those other components, now that continuous glucose monitoring is much more affordable and available, now that there's getting more focus on OGTT and insulin surveys, we're finding these things they're all being caused by the same thing. That's the focus. That's why this focus, and that's why COVID makes such a big point for this channel. It's the pandemic is really prediabetes. And did I mention prediabetes here? I realize
a dozen times.
Yeah, and I realize I did, but hopefully it's becoming. So Alphabet, poor lady coughing behind you had to leave the room.
Maybe I coughed in the beginning before I came on the screen. I don't know.
I don't know either. Aura Ruth coming in. Aura Ruth is dialing in from Israel, I think. Hi from Israel, where Passover is unlike any other we have ever celebrated.
I want to say to Aura Ruth that thank you for your detailed instructions on how to wash and
lettuce,
prepare different types of greens. I've taken your name off of it and shared it with a number of family members, your instructions only. But it's a team process where she lives.
Yeah, she's contributed a lot of really interesting stuff for the channel. Thank you again, Aura Ruth. Jay Chapman, what about eyewear and goggles?
I have not seen that in the recommendations. Have you?
No, and again, I think that underlines the point that I've made a couple of times. This appears to be more about protecting the air from those of us who have asymptomatic viremia, in other words, virus in the blood, and therefore we're coughing it out, we're breathing it out. One of the sets of information that I was unable to provide in terms of verbals on the slide, video on the slide, is some of those studies that are showing you don't have to cough, you don't have to sneeze. If you've got the virus, all you have to do is talk and breathe, and that's putting that virus out in the air. And yes, there's clearly droplet transmission, but there's also aerosol transmission, meaning if I cough it out in the air, it's not going to drop 3 feet from here, and when you come in the next morning or an hour later, you're protected. That's not the way aerosol is. It's still in the air, and you breathe it, and you can get infected. So, Jay Chapman, that's a great point about eyewear and goggles. And again, it helps underline what this recommendation about masks is all about. Dennis Williamson, prepared to discuss the partial PCR test. Not totally. I keep wanting to go back to the testing thing because, as I've shared a few times, we got involved in developing and setting up some national testing programs. They became a casualty to state politics. They also became a casualty to internal politics with the national retailer that was doing it with us. We've had requests to go back and provide this type of work, this type of structure for a huge employer in the UK. Whether that turns out or not, I don't know. But all of these still hinge on this key thing. And what is it that we don't have in terms of
tests?
We don't have tests. Yes. Now, there's been some development since last week. You're starting to see a tiny trickle. And Dennis Williamson's referring to a partial PCR, polymerase chain reaction. That's looking at the virus genetics itself. And there's been obviously a whole lot of talk about the antibody test as well. Then folks want to get into a debate about which one's better. We need both, and we need a whole lot more of both.
If you want to read an interesting article in the Wall Street Journal about the Patriots loaned their airplane to bring tests over from China, and the paperwork that was involved in that, they had 3 hours to pick up and leave before being quarantined. People that, the pilots, etc. They could have been quarantined for 14 days. They had to get a team involved in China to count the tests that came in, which most of the time were under the number that were counted.
Was this tests or masks?
I believe it was tests.
Either way, it's the same
Yeah.
thing. It's one of the big problems. We've got other countries that have both tests and masks available.
It's very hard to get over here.
But
So much bureaucracy on both sides.
the pilots had how long before?
3 days. I mean, 3 hours. 3 hours.
3 hours,
Or
and
they
had
would
to
be
back out.
quarantined for 14 days. But the supplies that came in, either tests or PPE, was undercounted from the various sources.
So how did they get all of those supplies recounted again within less than, and the pilots back out within
They worked
3
on
hours?
it. They worked on it for the week before. When the equipment started coming in, they had people counting it in China and going back to the sources to get up to the true count. So it's a it's an overwhelming task.
Yep. And just like everything else, a lot of the partisan politics came in on that. I heard a lot of people saying that the customs officials were being very restrictive about letting stuff in for political reasons. And again, I'm sure some of that happened, but I doubt that was the major driver. I mean,
It's multifactorial.
I'm smiling because, can I mention the name of our source that's helping us with this?
Yes, give her credit.
Pam.
My sister.
Janice's sister Pam is reading a ton of stuff. Obviously, I'm up to my eyeballs in terms of trying to get this stuff prepped and doing some of the other work with the testing programs and the consultations, in addition to seeing patients. Janice has been busy making masks and talking to Pam and her other sister Valerie. But thank you again, Pam, for all the information that you've been providing about good sources of news. Barnes J 0007. Be safe over there in Israel, and Jesus is with us. George Nakos, out this morning. YouTube will not allow me to upload the link. Researchers warn possible coronavirus treatment hydrochloroquine may be toxic when combined with diabetes drug Forbes. I don't think that's new news, George. If you look in India, Plaquenil or hydrochloroquine is actually given for diabetes. It has a major, it decreases blood sugar. So if you put that together with something like metformin, you need to be careful, or any of the diabetes drugs, because you're now combining diabetes drugs, and you need to be aware if you're going to do that. Now, diabetes drugs and drug classes are combined often, just like you do with, not as much, but just like you do with blood pressure drugs. Again, if you're going to do it, you need to be aware. Now, there may be some other, I've been aware of that. There may be some other components to this, and that's one of the things I'm looking to update on, just to check and make sure. Janice, I don't know. Here's one about masks.
Okay, I'll take that, and then I'm going to break call.
Okay.
Where?
Barnes J 0007. I've seen on Google News this person made masks from 2-liter plastic bottles.
I have not seen that.
I haven't either.
That'd be interesting.
Would be. Wonder if they're putting N95, trying to make some sort of N95 component out of that or whatever.
I mean, the recommendation on the CDC is cotton, so that's something pretty much I can say to that. They also have one that's a bandana with a coffee filter on the CDC.
I will, one other one about Dennis Williams said he's known about the N95 for over a decade. Actually, a lot of people have. N95 has been used in industrial settings a lot as well. healthcare settings.
Right.
But again, if you haven't used it in industrial or healthcare settings, you might not have known about it. It's supposed to get out 95% of problems or particles. And those of us, for example, I've lived that space on both sides, the healthcare side and the industrial side, but I still have learned a lot about N95 masks during this. For example, the surgical N95 versus the industrial and some of that. Thank you again for joining us, and you're going to go deliver a couple of masks.
Okay.
Okay, let's see what else we've got here. Kente 2, at this point, the CDC just looks ridiculous. Second order effect of this ineptitude is that anti-vaxxers will be empowered. Unfortunate. Or Ruth, my daughter-in-law works as a midwife in clinic where the docs are not taking precautions. So my son ordered dust masks and HEPA filters. He intends to combine the two. Thanks. Thank you, George Nakos. Put a wire around the front of the mask. Copper is very workable, about 16 gauge. Good idea. Thank you, Bob Weiss, and I appreciate that as well. We've got a lot of comments coming up, and gosh, when I clicked on that one, it just took us right down. I'm salty and lit. Dave, yes, all that's verified. Reports from many sources confirm they're lying. Raymond Garcia, hello. I use folded bandanas like Surgeon General just demonstrated. But for the ear loops, I cut out old stockings up into rings. Much softer and easier to launder with gloves when back home. Maybe glasses can fill the gaps. They do help a little bit. Richard Lund, remember to clean your eyeglasses after returning from shopping. Now we had, I think this is a good point to put that up. Dave Murphy gave it. Thanks again, Doc, for all that you do. And thanks to Janice for what she's doing as well. And thank you, Dave Murphy, for helping us support this channel. As you may notice, Carl has a bunch of stuff up here on ways that we can donate. Somebody surprised us on this, what, a week and a half ago and did a donation. I had heard of Super Chat. That's one way of doing it on YouTube, through YouTube Live, and that you see that up in the corner here. It's right next. It's just to the right of the chat icon. You can also use PayPal. We also have a Patreon account, and you see all of those. Thank you again, Dave. Dave has contributed a couple of times, and it makes a big difference because, as I've shared with the group, I used to support this channel with my day job, it was a significant amount that we went in terms of a negative cash flow for a couple of years. And then I retired again to go full-time on the channel to help get this message out about the pre-diabetes pandemic that's going on and killing folks. A lot of focus in terms of helping people understand that. But most of it's, again, come from Janice and me supporting it with our retirement funds. There's so much more we can do. And you guys making a contribution like this makes a big difference in terms of just, if nothing else, just our own attitude, because sometimes you feel like maybe people just don't care. This is the silent killer, and maybe people don't want to hear it. Well, a lot of it has to do with we need to improve the quality of our videos. We need to do some of those things. But hearing people say, you know what, we appreciate this enough to make a contribution makes a big difference. Thank you very much. Good Garden of Peas. I use folded bananas like the Surgeon General. Maybe glasses can fill the gaps. And your iPhone, you can iPhone if and when you use them to go shopping. Oh, clean your eyeglasses from shopping and clean your iPhone as well. Thank you for the reminder, Javidia, about the iPhone. Yep, I keep forgetting about the iPhone too. David Ivers, good morning. Could you repeat the Etsy name of the Kente cloth maker? I'm gonna try. That's orange Kente cloth fabric. And it is Camerica, CAMERICACRE, Camerica Creations. Thanks for asking, and I hope that helped. Let me go back. Haven't heard from Clyde in a few days. That's a long story. I hope Clyde's okay as well. Clyde got frustrated because he was having challenges working with other members of the team, and decided he'd rather just go ahead and not work with the team at all, rather than deal with some of the teamwork challenges. You know, that's yet another challenge that, oh gosh, you know, you try, won't go there. Tom Robertson, on deaths, the numbers are so large that adding a few more is insignificant. Well, it's significant to the people that are added and their families. Good garden and peas. Good point, Richard Lund. After cleaning your about cleaning your eyeglasses after going out. I put my eyeglasses over my bandana mask, and it seems to further minimize that gap on top. Jay Chapman, portable UV lights can be very effective. I've heard of the UV lights quite a bit. Monica, I don't know if you're any kin to Virgil Hockersmith. I used to work with Virgil down in Nashville, Tennessee. Good morning from Arizona. Here's one more from one more doctor from Kaiser News. Mysterious heart damage, not just lung troubles, befalling COVID-19 patients. There's no question that COVID does affect the heart. I think the big question is how long-term that is, but that's not unusual. Any of the things that tend to cause what we call acute respiratory distress syndrome, ARDS, the thing that's killing COVID patients, again, they have some immune system problems, mostly driven by prediabetes, unrecognized prediabetes, sometimes recognized high blood pressure. It's so much easier to see blood pressure. I think that was what was going on in China as well, that it's easy and simple to find high blood pressure. It's not so easy to find prediabetes. And I think that's why we got some of that red herring that in the beginning, that this was a high blood pressure risk factor issue. Almost all high blood pressure is in turn backwards related to pre-diabetic problems. Now, any of these problems that cause a heart attack, for example, obviously, but viral problems, other problems that end up with acute respiratory distress syndrome do cause damage to the heart muscle, and this one does as well. Is it inherent to the COVID-19, to the coronavirus itself, or is it part of going through that systems breakdown? When you go through ARDS, acute respiratory distress syndrome, you get systems breakdown of multiple different core organs, kidneys, heart, brain, etc. Or Ruth, hi doc, homemade mask gap can be reduced if the top tie cord around neck and bottom high cord on top of head. That's a really good point. I would demonstrate, but what you're doing is pulling that way. And I'm not sure why they didn't do that, Oral Ruth. It's a very interesting point. Oh, Erlander, please talk about how to defend against joggers and cyclists who run so close to us. They are pumping out more aerosol than walkers. In their arrogance, they think they are more healthy than us. That's a really good point, Erland. And I'm a jogger. I haven't done any cycling since the event, but I think it's inherent on joggers. I mean, because I'm more mobile than the people that are walking, I think it's my responsibility to get off the sidewalk or the road and get that 6 foot distance. It's a good point. It's a great reminder. You know, when Janice and I go walking, she gets so frustrated at other people. And quite often they're younger, they don't, you can tell they're just not thinking about it. They hear news from the governor or this or that, but they're not as deep in it as we are. So Janice tends to just gripe, and maybe I shouldn't have said that way. What we have done is we have found out that we get a better response with some of those walkers doing that if we make it a point to step aside like 20 or 30 yards before they get there, and they get the message non-verbally. Oh, wait a minute. Yeah, we need to be at 6 feet from each other. Now, Erlen, I think to your point, if a jogger comes up behind you, you don't know that. That doesn't help. And, you know, I wish I could give you some advice that would help for that situation. Alex J, good morning, Doc. How effective are surgical masks compared to N95? Well, surgical masks don't knock out 95% of particles and aerosols. Masks are not recommended around here, nor any lockdown of schools or schools closed. Actually, bars and restaurants still open. That is interesting. Where are you, Alex? Very interesting. George Nakos, the article says the virus may attack the heart as well as lungs. And I have no question that may be part of the issue. What I'd love to see the article. I'd love to see what evidence they have right now in terms of showing that this is a primary virus damage to the heart as opposed to an ARDS damage. I think again, we will get more clarity. I think we're getting more information about this one virus quicker than any disease that I know of. Robert Ostrick, is it a fair assumption? Robert, you look like a young fella, unless that's an old picture. Is it a fair assumption if a diabetic goes keto and his diabetic symptoms go away, that person could handle COVID-19 better? I think it is. I don't think that's been proven yet, but I would clearly recommend that people at least cut your carbs. A lot of folks really get, you know, just like everything else, even keto has gotten politicized sometimes, and it's like a lot of emotional battles on it. Bottom line is, if you're diabetic or pre-diabetic, it means you cannot you can't metabolize carbs. And if you can't metabolize carbs, why on earth would you eat them? It's not healthy. So cut that out. Fennell Hicks. Fennell, good to hear from you, and thank you so much for that contribution. Fennell gave us $20 to help move this process on. And then Fennell's got a comment coming up. I will share it in just a second. Monica, Joanne's was offering fabrics, materials for mask kits to make it home for donations. Fennell, my friend, hello, Janice and Ford. As you see, Fennell's there in his suit, spinning a basketball in his hand. Fennell's been doing a whole lot of work in terms of physical conditioning with some very high level professional athletes. For example, defensive ends, defensive tackles. Some of the defensive linemen for football are just set up for prediabetes as they get older, as well as some of the obvious things that we've already heard about with, you know, maybe brain injury, maybe osteoarthritis from damage to joints. It's a tough world, but physically for that, especially that type of athlete, and Fennell's done a huge amount of work in that space. Hello, Janice and Ford. Jelena and I will be welcoming a new baby boy or girl into the world in September. Should we be very careful as far as gestational diabetes with the current COVID-19 pandemic? Well, I think you should be very careful in terms of gestational diabetes, period. And here's the thing, for the baby's child as well as for Jelena, I mean, for the baby's lifetime risk, as well as obviously for Jelena's regarding COVID. Now, one thing that we haven't seen a whole lot of maternal deaths problems with children, whereas you have with some other viruses, some of the seasonal flu viruses. But here's one thing to remember. You know, people talk about me and my prediabetes, even though my BMI is like 20, goes between 21 and 22 routinely. I am not heavy like my dad was. He was my height, 5'10". He weighed north of 350 pounds much of his life. I weigh, my peak weight at one point was 180 when I was in college, but my weight now is like 155, 157. So my dad had more than twice of me on the same frame. And that's a big deal. What's been demonstrated with lab animals, and we expect it's true with humans, is that if the father is pre-diabetic at the time of conception, that greatly increases the child's risk for diabetes and prediabetes as they age. What we've known for a long time, maybe a decade or more, is that if the mother has prediabetes during that gestational period, while she's carrying the child, that she greatly increases that child's risk for prediabetes and diabetes as they get older. Now, another fact, again, it's not about me, but I'm using myself as a risk factor educational point. I was a 10.5-pound baby. By definition, that means my mom was pre-diabetic, had maternal diabetes until proven otherwise, and it'll never be proven or disproven. So I'm assuming that mom had prediabetes when I was in the womb, and I have every expectation that that contributed a huge amount to my risk of prediabetes in my late 50s, despite having pretty good control of dietary carbs and clearly very good control of body fat mass. So it's a great point, Fennell, and thank you so much for raising it. Nancy DeBosek, I hope I pronounced that last name correctly. $10. Thank you again so much for, I mean, again, more than anything else, the statements that you're willing to just say, look, we believe in this message that you're trying to get out, and we want to make a contribution. Thank you so much, Nancy. Dennis Williamson, thank you and Janice for all that you do. I've lowered my A1C level down to 5.8 using fasting, keto style lifestyle, and a Freestyle Libre 14-day sensor. I hope to document any infection. I hope you prevent any infection and avoid it. Thank you so much for sharing that. And again, we see a lot of that in our channel. As for those that have seen the channel before, you know, a couple of times a month we get these comments from people that say, hey doc, I decided to do some of this stuff. I decided to Libre, or I got an OGTT, and no, I'm not pre-diabetic. I'm full-blown diabetic. Old Alabama Gardener said that a few months ago, and he's done some videos with us and shared that he became a patient. And he was, you know, it's just like many others that, you know what, my doc said I had no problems. So again, buyer beware. This is not slamming other docs. There's plenty of research that's been done about why your typical primary care doc does not understand prediabetes. Doug Thompson, Ford, you're getting into trouble answering the jogger question. Leave Janice out of it. That's a good point. I hope she won't see that part. Anyhow, I mean, it's a good point. I'm just sharing with Erland that this is a problem. People are just not aware. They're not thinking. And frankly, I was one of them. I was originally just discounting the thing of, you know, you walk past somebody or you jog past them, you're only at most getting just a little bit of their air, you know what? Why even get a little bit of their air? Go ahead and maintain that distance. Bob Weiss, what about a large sock as a mask? Lots of fabric, goes all the way around. You know, I used to have these giant wool socks, and before face masks made it back out into circulation, and before the age of Amazon, I was an ER doc, and I would working swing shifts, so I had a big issue in terms of trying to sleep. I got this big wool sock, and I can't help it. You know, sometimes I share some of these crazy stories about my past. So I was an ER doc. My first job, I lived in Shalimar, Florida, near the beach there, and we would do swing shift. And I've always had trouble sleeping, so that just made it worse. Now, the other weird part of my background is that at one point in my life, I actually played bagpipes. Yep, you know, the Scottish thing, and you know, the big bag that you use for air. And when you played bagpipes with a group, you'd have these big socks, these wool socks that, you know, they went up to your, anyway. I found a purpose, a reuse for those big socks. I used them for an eye mask, because sleeping is as important as any of these other lifestyle components, and that made getting the light out of your eyes when you sleep is a big deal. Now, if you go on YouTube, I'm not going to walk over to get it, but I use this, and I've made a gift to a lot of friends. Actually, I will get it. You can hear me, but it's called Alaska Bear. And if you're looking at maintaining your health, one of the things you need to do is read a book by Matthew Walker. Matthew Walker, it's called Why We Sleep. And he talks about the importance of sleep masks. This one, as you see, it's not like your typical one, which doesn't have that much covering for your eyes. It covers the whole eyes completely. Anyhow, pardon the digression. Those of you who have seen me before know that I tend to go from one bunny hole to the next to the next. So yes, large socks work as a mask. I've proven it. Nancy DeBrozek, kudos. Thank you again. I appreciate that, Nancy. I came prepared to answer any quandaries, questions. Well, thank you, Dennis. Too bad you're not here with us. John Benda, interesting story from ABC New York about transfer of coronavirus from the zookeeper to several lions and tigers. Yes, Janice made me aware of the tigers at the zoo having coronavirus. And guess where Janice got that? She got it from her friend, or her sister, Pam. So thank you again, Pamela. Dennis Williams, Johns Hopkins is big and has been around for a very long time. Did you know John Wesley Williamson? I did not. Sorry about that, Dennis. Alex J. Sorry, Doc. Oh, that Alex. I'm sorry, Alex. I was forgetting. Yeah, I read a great article about how Sweden and I think Denmark are managing this coronavirus lockdown, as in there isn't one. Only country in Europe that life goes on pretty much without any mandatory restrictions, rather recommendations, and people listen. It must be the Nordic genes. Thank you again, Alex. And again, Alex has contributed recently. He contributed something like 200 kroners, and that became an interesting discussion about kroners and making phone calls back to the US. So we've had a lot of interest. Thank you guys for tuning in. Thank you for your interest, your focus, and we'll talk to you tomorrow. Thank you very much, Carl.